So just before I start the procedure, I would perform hand hygiene, and this is just to prevent any cross infection. I would then briefly explain the procedure to the patient and ask them something like, is it okay if I take your blood pressure, just to get their consent. And once they've said yes to that, I would make sure the patient is seated and has been for the past 5 to 10 minutes prior to the procedure and hasn't consumed any nicotine or caffeine or done any excessive exercise, as this can all affect the blood pressure reading. I would then ask them to remove any restrictive clothing that they have on. So if they had something like a jumper, I just asked them to maybe remove that just so I could put the cuff properly onto the arm. Then I would place their arm at heart level faced up and maybe put a cushion or a pillow under it just for comfort reasons. Then I would place the bladder of the cuff on the upper arm, and I should cover about 80% of the arm. This is just to make sure that you get a proper reading. I would then check their brachial pulse, which is just here. Sorry, I don't know if you can see properly. Yeah. And I take an estimate of the systolic pressure just before I inflate the cuff. So I would take note of that. It should be roughly 100 to 115. Then I would inflate the cuff 20 to 30 millimeters of mercury above the estimate in the previous part. And I would then take note from where I can no longer feel the brachial pulse, as this is what my systolic reading is going to be. So I would take note of that, and then I would slowly release the valve and deflate the cuff, and I would do this at 2 to 3 millimeters of mercury per second. This is just to make sure it's in a nice slow and controlled manner. So then the patient's blood pressure should be about 120 to 80. That would be a normal blood pressure for a healthy adult. And then I would record it on a vitals chart, which looks like this. And as you can see, sorry, I'm not sure you can see very well, I have recorded it. I think that's the 120. Yeah, it's hard to see here. So I just mark the 120 and 80. So you've just documented that properly. And the last thing that you would do again is just perform hand hygiene again after the procedure and make sure the patient is okay and happy. So yeah.